A very good afternoon to all. My name is Audrey Chi, the Business Manager for ConvaTec Singapore. I am the MC for today's webinar. On behalf of the Ostomy Association of Singapore and ConvaTec, I would like to welcome everyone to the first collaborative virtual webinar on the theme Life After an Ostomy, Navigating the Journey Together. Before we commence the webinar, I would like to state some ground rules for the attendees. You will be muted throughout the webinar to minimize disruption during the sessions. You can, however, communicate via the chat window. If you have questions during the webinar, please post those questions in the Q&A window, and the speakers will be able to answer the questions at the end of the presentations. Kindly note that the webinar will be recorded. Please turn off your camera function if you do not want your face to be shown in the video. I would like to now invite Mr. Eliel Matian, the President of Ostomy Association of Singapore, to give the welcome address and to introduce the first speaker. Mr. Eliel, please.
Thank you, Audrey. Good afternoon, ladies and gentlemen. Thank you very much for spending your precious Saturday afternoon with us. To start off, I would like to introduce the OAS team to you. With me today, we have Joan, Biswat, Celeste, and Yokling. Right? I want to express my thanks to our wonderful team in putting today's webinar together. These are challenging times, and everyone is having to adjust to the new normal brought about by this pandemic. More so for those who need to have support, whether physical or psychosocial, to manage and cope with their condition. Physical gatherings for support groups have ceased since late 2019 for colorectal patients. So it is timely, and we are grateful to ConvaTec for holding this webinar to reach out to ostomates and healthcare professionals. This webinar is part of our patient and healthcare professionals education series, which we host in collaboration with our partners like ConvaTec to provide our members with useful information and knowledge which they can apply in their daily lives and help improve their quality of life. We are indeed blessed to have two very distinguished presenters today who have very kindly accepted our invitation. Prof. Francis Xiao Chun has had an outstanding and distinguished career in public health before moving on to the private practice, and Audrey will introduce him properly in the second part of this webinar. Now it gives me great pleasure to introduce our first presenter, Ms. Sarah Russell, ostomate author, marathoner, Pilates exercise specialist, physiotherapist, researcher, advocate, and most importantly, she is now specialized in training and coaching people who have a diagnosis of cancer or those who have undergone stoma surgery. She lives in the UK, and we are really thankful and grateful that she is joining us at this very early hour. And so without further ado, may I please invite Ms. Sarah Russell and hand the time over to her. Sarah?
Good morning, thank you. Just making my slides work. Is that working?
Yes.
Yeah, wonderful. Thank you for inviting me to speak at this webinar today. It's a real privilege to be here. And as you say, it's very early in the morning on Saturday. I just want to talk about my story, my personal story, but also my professional story over the last 11 years since I had my ostomy surgery. And I want to take some questions at the end, I think for about 5 or 10 minutes. So please, if you have any questions, put them in the chat and then I'll address them at the end. So I am a clinical exercise specialist and a clinical Pilates teacher. I live here in the UK and I'm the global exercise consultant for ConvaTec. I've worked in exercise and fitness my entire life. I've been a marathon runner, Ironman triathlete, I climb mountains. And then in 2010, I was training for an Ironman triathlon and I had very severe abdominal pain, was taken to hospital and I needed to have ostomy surgery. And I didn't know I had a problem. So it was a real shock. And it was an emergency surgery. And I remember being really shocked by this. I was in my late 30s, I had 2 small children, and I thought I was really fit and didn't have any problems. And my bowel had perforated and I had peritonitis and needed to have an ostomy. And I then had a lot of complications and needed to have 5 surgeries over an 18-month period and had 3 different stomas. But I remember very clearly at the time thinking, was there any help for how to get myself strong again? How would I find out how to get my abdominal muscles strong again? And what exercise could I do? What was safe? What wasn't safe? And I felt, even though I was a very experienced exercise specialist, I felt really confused about what was safe and what I could and couldn't do. When I first came home, I genuinely thought I had a disability that might prevent me from doing anything again. So I went on the internet and I found a man called Rob Hill, who had just climbed Mount Everest. And he's a Canadian mountaineer and he has an ileostomy. And I thought, well, if you can climb Mount Everest when you have an ileostomy, I'm sure you can do almost anything else that I want to do. So I thought, okay. So by this point, I was 18 months after my first surgery and I was starting to get my life back on track. And I decided I was going to start getting my running back. So I started training again, just very, very gently. I started maybe just with a little bit of a jog and a walk, and I started to work very specifically on developing my abdominal muscles again in a really safe way. And because there wasn't any guidelines, I started to do a lot of research and actually just work out what was safe and what wasn't safe. And because of my background, I have a postgraduate degree in sports science, I was able to understand this and kind of put together a program. So as I was rehabilitating myself, I was keeping notes and making a list of all the different exercises. So 9 months after my surgery, I went over to, I'm just trying to make my slides work here, there we go. I went over to Switzerland, and this picture on the right here in the yellow top is me and my husband doing a marathon in Switzerland, which was in an upper mountain. And that was my first marathon after I had my surgery. And it was really an amazing day because I thought at one point I was never going to be able to go running ever again, or eat food ever again. And there I was doing this really challenging mountain marathon, not very quickly, but I did it. And I was really, really ecstatic about that. And then really from there, once I'd done that, I realized that I could do the things I wanted to do and get back into normality in life. And yes, there were challenges, and there were challenges with dealing with the ostomy at times and with hydration and maybe nutrition and managing the bag and if there were leaks. But for the most part, those things I could overcome them, and getting my life back was really important. So the thing, I'm going to share some of the things I've sort of done since then, and this picture on the left is my family, and they were a bit younger then. They were much older and all a lot taller than me now, but this picture was taken again in Switzerland on a family holiday, and we went to Switzerland, sort of climbing and walking and mountain biking. And you know, I just love being in the mountains, and I don't want my ostomy to stop me from doing those things. So this picture on the left is with the Matterhorn behind us in Switzerland. And then the picture on the right is when we went mountain biking in France. And that is Mont Blanc behind us. So as you can see, I'm sort of a bit of a mountain lover, and that's my absolute passion. There's nothing more I love than being in the mountains. So, and I don't want my stoma to stop me from doing those things. So some other things that I've done since then. In 2014, so this was 2 years after my surgery, I went over to the Himalayas, to India, to do a 100-mile run over 5 days. And again, before I went, I nearly cancelled it because I thought I can't do it, it's too difficult. I'm going to struggle with the hydration and the nutrition, and I'm worried about being sick. And it was a really remote event in the sort of mountains in India. So it was very scary, but I just decided to give it a try. And what was the worst that could happen? So I gave it a try and went out there, and it was an amazing, wonderful event, and I completed it and made some really good friends, and it was really, really amazing day, and an amazing 5 days. The doctor who was supporting the race was a gastroenterologist from a hospital in Delhi, and he still talks about this crazy English woman with the ostomy who came out to do this race, because he said he never thought he'd ever see somebody do this race with this condition, and I proved him wrong. And he said he was going to go and tell all of his patients what was possible, because he thought that it was never going to be possible. So I then, a couple of years later, went over to Colorado with my husband, and we ran 120 miles over 6 days through the mountains in Colorado in a run called the Trans Rockies. And this was more challenging because of the altitude effect. So we hadn't really spent enough time preparing at the altitude. So I struggled a lot with the altitude here. But we did it, and it was an amazing experience. We did 120 miles of sort of running and hiking over the 6 days. One of the most challenging parts of this event was actually having to camp every night. So camping with an ostomy is more challenging than you know, if you don't have an ostomy, and so that was the part I was most worried about. And having to get up in the middle of the night with a head torch to go and empty my stoma bag was slightly inconvenient when it was cold and dark at night, and you've only got a torch and you've got to fumble through a campsite. But again, the more things I was doing, the more I was realizing that actually my ostomy didn't stop me from doing anything. And if I had the right plans and I had the right structure, that I really could overcome the difficulties and the challenges. And of course, now I know lots of people who do all sorts of things. They do Ironman triathlons, they climb mountains, they do Kilimanjaro, they climb Mount Everest, they run very, very competitive marathons. And I know a lot of people now who are performing at very high levels and really not letting their stomas stop them from doing the things that they want to do. This event was a kind of training event there's just the photos are quite funny, because we had to do this training event, and all these guys in the back there, you know, none of them knew I had an ostomy. I'm just there doing this training day. It was a kind of mud run race, practice, and we were sort of having to train carrying logs, and you know, a lot of the ostomy advice is don't lift heavy things and be very careful, and these pictures are showing that really I'm not paying much attention to that at all, because you know, and you can see the joy on my face of how fun I'm having, but also having an ostomy and being in this environment and not letting it stop me doing things, I think is really a really important message. These pictures were taken only actually a few weeks ago. This is in the English Lake District here in the UK, and again, just being in the mountains with my dogs and my husband, and we went quite high. There was a snow line this year, and just being out all day for sort of 8-10 hours, just hiking and running and being with my dogs, and it's really what I love doing. So yeah, so there we go. I don't sort of really try not to let it stop me. I mean, being in the mountains for that long is sometimes challenging, and I was talking to somebody about how you manage emptying your bag and where you do that, because obviously there are no toilets at the top of mountains in England. It's very rural, very remote. So how you do that, and so I have some strategies on how I do that, and that really involves using different bag systems, or taking a container so I can empty into the container and I don't have to find a toilet, and I just then take it with me. So there's different ways and different strategies of overcoming the things that you think might be difficult. And there's some more pictures of my husband and me in the mountains. You can just see the joy that I get from doing that. And I sometimes think, you know, I feel so sorry for the people who don't feel that they can do the things that they want to do in life because of their ostomy. And I would really encourage everybody to try and find ways to overcome the challenges, because you don't want to live your life sitting on the sofa. You need to live your life doing the things you love doing, and the work and enjoying your life to the best you can. Now, the work I do, I'm a clinical Pilates teacher. So I teach Pilates and exercise and fitness to a wide range of people, not just people with stomas. I train people who are runners who don't have stomas, and I'm teaching very high level Pilates, which involves a lot of abdominal exercises. As you can see here, you can't even see my ostomy, and you can see I'm doing some quite challenging abdominal exercises. And I've built up to that over a period of many years, and built up to that in a very clinical physiotherapy-led way. And that really starts with the post-operative rehabilitation program. So the program that I've developed for ConvaTec, which is called Me Plus Recovery, and that's a program that anybody with an ostomy can do. It's a starting point, and people would start that immediately after surgery if possible, but at any point if someone has never done that sort of exercise. Now, these are not exercises in this picture here that you would do. They're much more gentle, much easier. They can even be done in bed or sitting in a chair. And those exercises are all in the Me Plus Recovery program that I developed for ConvaTec. So over the years, I've built up my strength, and this is now sort of me teaching classes and teaching sessions that I do online to patients in the UK and all over the world. So I have classes for ostomy patients. And last year I wrote a book called The Bowel Cancer Recovery Toolkit, which is available on Amazon on Kindle. And I think it's also available internationally as well. And so, yeah, so that's me. And my sort of passion is really about not letting my ostomy stop me, but also empowering other people to feel more confident and to overcome all the fears that people have around what is possible when you have an ostomy. And for the most part now, I almost even forget I've got one, because I've had it for 11 years and my life is so normal. My husband and I were running the other day, and I said to him, oh, I need a different type of drink pack to carry my drink. And he said to me, well, why do you need that? And he'd forgotten that I had an ostomy. And our life is so normal now that it doesn't even feature as a thing anymore, because it's almost forgotten about. And I think if you can get to that point, that's a wonderful place, because it's just so normal and just so part of you. And for me, that's really where I'm at now. But the work that I do with ConvaTec and the work that I do through my ostomy studio, my own private practice, is what I love most. And so over the years, I've now specialized. This is the only work I do, is working with stoma patients and with cancer patients, and really just showing people how to rehabilitate safely, how to recover after surgery and cancer treatment. And the joy I get from seeing people get their confidence back is why I do the work that I do. So I can see some questions that have popped up into the chat. I'm going to have a look at those. Okay. Thank you. You're such an inspiration, Sarah. Is there a need for someone who has an ostomy to watch your diet? Okay, so I'm not a dietitian, but I have a lot of knowledge about nutrition, and obviously I have an ostomy. Now, it depends on the type of ostomy you have. If you have a colostomy, which is formed from the colon, there's less requirement to be careful about your diet. If you have, oh, you'd like to answer this question live? Okay, I'm not sure how that's working. I'll just keep talking. So if you have an ileostomy formed from the small bowel, then that's going to be more requirements, certainly initially, to be more careful. But ultimately, really, you can eat pretty much anything you like. I have a very, very normal diet now. I eat almost anything I like. There's a few things I'm a little bit careful with. Some things like some really hard vegetables that aren't very well cooked, and maybe lots of meat that don't work for me. But what I've learned is that everybody's different, and people have to find what works for them, and to try small amounts of food and just see what works well and what doesn't work well. But ultimately, I would say you need to focus on eating a really healthy, healthful diet that has the range of fruits and vegetables and protein and carbohydrates and all the healthy things that we need. And we shouldn't be too scared or too restrictive. Initially, after surgery, I think it's probably important to be a little bit careful, but build up your confidence. That's what I would say. When do you recommend an ostomate to start the abdominal exercises to tone the abdominal muscles? Okay, so we have some clinical guidelines here in the UK that have been published by our stoma nursing organisation, and they say that we can start to do very, very gentle abdominal exercises within 4 days post-surgery. Now that might sound really crazy, but what we're talking about is just drawing the abdominal muscles in, tightening them up, doing a little pelvic tilt, bringing a little bit of strength to the abdominal wall whilst it is healing. And that's the important thing, because just bringing a little bit of stimulus with a little exercise to the healing abdominal wall can actually improve healing in the long term and potentially reduce peristomal hernia. So that's the work that I'm very passionate about, is an early intervention. And that's what the Me Plus Recovery Program is, and that's what we advocate. However, everybody's different. Some people won't be ready to start it at 4 days. So it's really about when you feel ready, and when you're well enough to execute the exercises. But also I would say we don't wait for 6 weeks, we don't wait for 12 weeks, we start to bring a little bit of stimulus to that abdominal wall with the correct exercises. And they are very simple and gentle. And then you build up over time, gradually building strength and gradually building confidence. For patients with a peristomal hernia, can still perform abdominal exercises. So can people with a hernia still do exercises? Yes, absolutely. I'm involved in a clinical trial here in the UK, and we are training people with exercises who have hernias. And it's safe. We're not seeing any problems, but it's important to do the correct exercises. So all the exercises that are in the ConvaTec Me Plus recovery program would be appropriate. And I'd say maybe 70% of people who come to my online classes have a peristomal hernia, and they do really well. And what we're seeing is people are getting control of their muscles. And a lady said to me the other day, for the first time, I now feel in control of my hernia, whereas it used to control me. So she feels like she's got this muscle control underneath her hernia, that she's able to draw the muscles in, and that's really important. She's having surgery soon, and the surgeon is hopeful that because of the work she's done, she's now going to have a better outcome. What do I take for hydration? So that's something that I've worked on very, very hard over the years. I use an oral rehydration solution all the time. So I either buy sachets of powder, and I'm not sure, I mean, I'm sure you can get them in every country around the world, but certainly when I was in India, it was a very popular thing. You could go into any chemist, buy a sachet of oral rehydration solution, and I would drink a litre of that a day, and sometimes more. In the UK, I make it up with powders and salt. But certainly I would speak to your ostomy team and your nurse, but look for the oral rehydration solution, which is a World Health Organization standard solution. And, you know, I would try that. And it's very important to have the right amount of sodium and the right amount of glucose in that drink. Do you wear an abdominal binder when you're exercising? No, I don't. I feel that I've developed my own internal muscles that create my own abdominal binder, and that's my sort of internal support. And I think that's really important that people do that, but that comes over a period of time. So if some kind of support helps you feel more confident and helps you feel that you can then exercise, and that would be helpful, but you mustn't rely on it. It's important to build your body so it's working correctly and the muscles are working and you've got more feel. A lot of my patients say that they prefer to exercise without because they have more feel and they have a sense of more control. How am I doing on time? Just tell me when I need to stop, please, somebody.
Sarah, there's just a couple of questions in the chat, and I thought one was particularly pertinent, and that is, how do you determine the safety of Pilates for ostomy patients?
Okay, so the most important thing is the type of Pilates I teach is a physiotherapy-led clinical type of Pilates. So there's lots of Pilates methodologies there, and we need to make sure that we're choosing a level that's right for us. So we need to choose the most basic, gentle level. And that might, I mean, there's an organization called APPI, and they are an Australian organization, and that's who I've trained with. They have teachers all over the world, and they also have classes. So I would look for somebody who's trained with APPI, and they are going to be able to teach Pilates in a clinical, safe way. The most important thing to do is to minimize pressure, intra-abdominal pressure when we are exercising. And the APPI method of training will help you do that. Don't just go and do any old Pilates class, because sometimes it can be very challenging, even a beginner level. So we need to start with something very appropriate, very gentle. Look for APPI, clinical, physiotherapy-led. I also have a range of 12 videos that are on my website, the Ostomy Studio, and they are available to purchase, and you can just view those videos from anywhere in the world and to do them at any time. Why do I not? Okay, are there any more questions, or what do I need to stop?
Sarah, you still have about 5 minutes to go.
Oh, okay. Okay.
Okay, there's this question from Patrick. Okay, he's asking that he actually has an ileostomy and have gone through radiotherapy and chemotherapy 6 months ago. And he mentioned that he has some side effects of numbness under his foot and fingertips from those therapy. And he's asking, what would you suggest, the kind of exercise for his condition?
Yeah, really lovely question. It does tend to get better. So what you're talking about there is something called peripheral neuropathy, which is just a sensation of the nerves have been affected in your fingers and your feet. It's very normal. Unfortunately, it does get better in the majority of patients. So what I found with a lot of my patients, particularly for their feet, is having a massage ball under their foot and rolling a massage ball to stimulate the surface of the foot, and that can be really effective. That works really well with a lot of my patients. They like that. It's like a spiky ball and just massage under the sole of your foot. And with your hands, I would, again, just squeezing things, trying to bring stimulus back to the hands and the feet. So just squeezing a ball, squeezing maybe some socks, something soft, and just exercising all the time. But know that it probably will get better. Somebody says there, is there a website where the osteomet can refer to for the exercises they can do post-surgery, or do they need professional guidance? So yes, the Me Plus Recovery program that ConvaTec have produced is exactly that. So if that's available where you are, you can just follow those exercises, and that's all very safe and very appropriate. And that's exactly why I've developed it. And there are exercises on the floor, but also in standing and in a chair. And obviously my website as well, where you can access videos, and there's a post-surgery program that you can start. I think it's about 3 weeks post-surgery. Okay, there's another question about strength for abdominal support. So I don't wear any abdominal support. You can see in those pictures I'm wearing tight clothing. So in a way that kind of provides support for the bag, but it doesn't provide support for my muscles, because my muscles are strong enough to support me. And so I would try and think about developing your own internal abdominal support with your muscles, and then you won't feel like you need to wear anything.
Sarah, can I just jump in here as a question I think is affecting a few people? Is those with two bags, ileostomy bag, colostomy bag, or colostomy and urostomy? And the question is it still safe for me to do different types of exercises and job? Yeah,
of course. I've got a lot of clients who've had very extensive surgery and that have both bags. Absolutely, and more important, because you've had more surgery and more extensive surgery, it's even more important to do the right exercises from the start. So the Me Plus Recovery exercises are safe, and when you do them, you realize that actually they are they're very appropriate, and they feel safe because they're not challenging, and they're no more challenging than if you're walking around your house picking up a bag. And actually what we want to do by doing these exercises is create a body that feels strong enough to go and play with your children, or go shopping, or go to work, or do the things that you want to do. And if that's exercise as well, then that's great. But use these exercises as rehabilitation. This isn't about necessarily needing to go and run marathons. This is about doing something which is going to help you lead a more confident life. Are there any more questions you want me to?
Sarah? Yeah, I have a question. Will you be able to give us the website?
Yeah, so the logo that's on the front there, if you just Google the ostomy.co.uk, and that's where everything is, or if you just Google me, I work with clients all over the world. So I work one-to-one with patients, and it's a private practice, and I have patients in Australia and Canada and America and all over the UK, and I'm very happy to work with anybody anywhere. So yeah, please look me up. But the Me Plus Recovery ConvaTec, or the exercises from the ConvaTec Me Plus Recovery program, are really the starting point. Start there, progress into my videos, and you'll find that suddenly you're thinking, this feels a lot better, I feel a lot stronger. and they feel safe. So yeah, there's just a couple of questions about prolapse. A prolapse is very similar to a hernia in that it's just a weakness and your muscles aren't strong enough to support the area where the stoma is. So it's all about managing pressure. So we need to exercise in a way which is reducing excessive pressure. And so, yeah, they are safe for people with a prolapse, and actually they may actually reduce your prolapse if you're exercising properly, because we need to draw in rather than push out. I think I might be out of time.
Yes. Actually, to add on to Joan's question, just to share that, the Me Plus Recovery Program is coming to Singapore. So the details will be available in our local website very, very soon. Okay. Later, Jurina will be sharing on those details in a while.
Okay, thank you very much.
Right. Thank you, Sarah, for such an interesting presentation.
Thank you very much. I'll stop sharing and then I'll go.
Okay.
Thank you.
Yes. Thank you very much, Sarah. Okay. Let me go on to slideshow. Okay, our next speaker is a well-known figure to many of us. Prof. Francis Siao Chun is the Medical Director of Siao Chun Colorectal Center at Paragon. He was previously the head and senior consultant in the Department of Colorectal Surgery, Singapore General Hospital, the Director of Endoscopy Center, and the Director of Surgical Oncology at the National Cancer Center. He has firmly established his name in the field of colorectal surgery and is frequently invited to lecture and to demonstrate surgery all around the world. Prof. Siao is also frequently consulted by surgeons all over the world with regards to the best method of handling difficult stoma cases. He was the founding president of the Asian Federation of Coloproctology and the president of Society of Colorectal Surgeons of Singapore in the year 2005 to 2007. His achievements in the field of coloproctology was recognized by the conferment on him of the Excellence of Singapore Award in the year 2000. He was also the founding president of the Eurasian Colorectal Technology Association. Without further ado, let us welcome Prof. Siao to speak on the topic of home management of common stoma problems. Prof. Siao, please.
Thank you very much, Audrey. Now, thank you very much again to ConvaTec for inviting me to this seminar. Now, let me just share my screen. Now, I think we had a very good session with Sarah, and I just want to carry on here with home management of common stoma problems. I think, stoma really is like a child. When we don't understand him or her, we're going to have a lot of problems. But once we grow with it, we learn to not just live with it, but to love it in some ways. And I think, that is very important for us to understand today. Now, the problems with stoma, or the universe of the stoma, is very wide, and we can't cover everything in detail. And I think I'm just going to concentrate on a few aspects which I think are very important for us today. So today, and I've seen from the questions that people ask, these are things that my patients often ask me, and I think these are things that I'll try and cover in some detail today. Firstly, we're going to talk about stoma and diet, which I see many people having questions about. And we're going to talk a little bit about stoma complications and how we deal with them. And healthy living with a stoma, we see Sarah has covered quite a bit of it, but we'll just go through some of it again. So, stoma and diet. Now, why? First of all, as we talk about diet, we need to understand why we eat. In my practice as a surgeon, people ask me, Doc, what should I eat? What should I not eat? And I always ask my patients, why do you eat? Why do we eat? And I'm shocked, actually, that many of us, having lived 20, 30, 40, 50, 60, 70 years, don't know why we eat. And most of us are stumped, but I think the most important, and I think as we talk about normal living, restoring ourselves to normal life after surgery, the most important reason for eating is enjoyment. We need to live our life. We need to enjoy what we eat, just as we enjoy the exercise that Sarah was talking about earlier. Now, we also eat for nutrition, and we mustn't forget what nutrition is. Nutrition is everything that we need in our lives. There are a lot of misinformation going around in the world, not just amongst the common folks who are not doctors, but even among doctors, a lot of misunderstanding. And energy, we all need energy. We cannot do without energy. And so as we talk about this sort of wholesome approach to diet, we begin to understand what sort of foods are important. Foods that we like is very important for restoration to normal life. However, how much of those things we like, we should eat depends on what we need. Now, if you are like Sarah and you want to do a lot of exercises, you need to build your muscles, you need to eat your meats, you need to eat your protein, and you need to eat your carbs. You know, there's a lot of misunderstanding among cancer patients that they should not eat sugar because sugar will feed cancer. Yes, cancer cells feed on sugar, but so do every other cell in the body. You cannot kill cancer cells by not eating carbs because you're going to kill yourself first. All right. So I won't talk too much about that now because it's going to take us a whole day. So now, knowing what we eat and why we eat is important, but what should we not eat? Now, a lot of people eat because they want to pass motion, normal patients as well as stoma patients. We should not eat to pass motion. Passing motion is not the goal of eating. Passing motion is a side effect of eating. The things that we cannot digest, we need to pass out. Plus, the bacteria lives in the gastrointestinal tract or in the colon or in the bowels. Now, that's very important because that will help us also to understand what I'm going to talk about here. So what should we not eat? Now, before we discuss this, we need to understand the difference between our original anus and a stoma. Now, the anus is stretchable. If your feces is bigger, the anus will expand a bit more. Of course, we're going to expand it too big. But if the motion is small or liquid, then the anus don't have to expand so much. A stoma is, on the other hand, is different. This is where a lot of people don't understand. A stoma is a fixed diameter. If your feces is big, it won't come out a small stoma because a stomal opening is not stretchable. Now, also, most people with a stoma would have a much shorter intestine left behind, and therefore there's less absorptive surface. So if you take something that is irritable, you take something that is going to not be so digestible and is going to ferment, you're going to have more diarrhea, you're going to have more gas, you're going to have more output. That's something that we have to understand here. Now, so just a question, because I know most of you in the audience would have had the stoma for some time, so it wouldn't be acute stomas, they would be stomas you've had, you know, have to look after for some time now. So why do well-functioning stomas sometimes get blocked? Now, understanding what I've just said gives us some clue. First of all, a lot of us have been told by our family or by our friends or even by medical practitioners and nurses that fiber, dietary fiber, vegetables, fruits, cereal, etc. are very important for our health. Actually, that's not really true. Now, I don't want to cover this in too much of a detail, except to tell you that dietary fiber in our diet, in vegetables or in fruits or in cereal, etc., actually are not digestible. Now, Sarah talked earlier about hard vegetables. Well, actually, there's no such thing as hard food or soft food. Now, a piece of steak, whether it's cooked, whether it's roasted, whether it's barbecued, whether it's chopped to pieces, whether it's swallowed whole, is always digestible. Digestion doesn't depend on whether food is hard or soft. Digestion depends on whether we got enzymes or not. And unfortunately, humans, unlike pandas or cows or goats, don't have enzymes or don't have, to digest cellulose. So we cannot digest fiber. So if a person suddenly decides to take more fiber, they are going to get obstructed if the stoma opening is small. That's why we call fiber bulking agents. That's why in hospital, we call fiber high residual diet, whereas carbo and meats are called low residual diet because they don't make feces big. And that's why we call fiber roughage, because they make feces bulky and rough. So another cause of obstruction, of course, is if your stoma is extraordinarily small, that means the surgeon has not made it big enough. Now, normally for ileostomy, we like it to be at least 1 finger breadth big. For colostomy, we like it to be 2 fingers breadth big because ileostomy tend to be watery the contents, whereas colostomy tends to be bulky, the contents. And sometimes in the early stages, if you had just had the stoma done, the stoma may block because it's edematous. If you give it some time, it will shrink and it will be better. In those patients where the ileostomy is small and edematous and blocked, we can put a catheter in to temporarily relieve the liquid stools, and that will allow the edema to subside. Also in edematous stoma, just like prolapse hemorrhoids or prolapse bowels, we can apply just very fine sugar or very fine salt, and that will draw out the fluid and allow the swelling to decrease, and that may, help you tide over the acute event. Now, some people, of course, suffer from very high stomal output, and this may be chronic because of your bowels are very short. And really, if this is because surgery had to remove a long segment of your bowel, then you either have to take, constipating agent, which makes the stool function slower, in which case the body can absorb more fluid, or you have to take care not to take foods which are very irritant to your bowel. And that, I like to say, in a lot of especially East Asian people like Chinese, Korean, Japanese, and so forth, a lot of us lack the enzyme lactase, so we can't digest lactose, which is milk sugar, and that includes ice cream, yogurt, a lot of biscuits, some cakes, and so forth. So that we have to assess for ourselves. Now, if you have been living with stoma for a long time, suddenly you get a high output. That may be because of recurrent disease, like, inflammatory bowel disease or acute food poisoning, which can occur in everybody with or without the stoma. And of course, I mentioned earlier, food sensitivity or food irritants. Now, it's important for people with very short gut, with a stoma that is very proximal in the gastrointestinal tract, to try and avoid these sensitive foods. A lot of normal people with a normal colon and intestine, have diarrhea or have very sensitive bowel, eating irritant food like pepper and chili and curries and so forth. If that's your case, you might want to avoid these things, or only take them when you are near to a toilet or able to, look after the effluent if it's too much. Now, I just wanted to show you some pictures of some complications. Some of you mentioned about prolapse and so forth. Stomal prolapse is something that happens, especially when the intestinal pressure is high. It may happen in a terminal stoma or even in a loop stoma. Of course, if it's temporary stoma, it can be closed. But if not, then other corrective surgery may be needed. Sometimes stoma gives problem because of unstable site that's been used, and this may be corrected surgically. Or battle-scarred abdomen, where the surgeon has a hard time finding a good place, and he may have to put a stoma in not a very ideal place. And skin issues, these are very common. It may be reaction to the adhesive, the stoma appliance, or it may just be improper placement of the stoma appliance or leakage. And you can see here a patient with a retracted stoma with leakage causing skin irritation. Retracted stoma happens. Sometimes the intestine is very short or foreshortened, and the surgeon is unable to bring a proper loop up. It may be due to surgical error, or it may be due to excessive weight gain after surgery, or scar tissue or improper placement of the stoma. And some of this can be corrected surgically, but a lot of them can actually be managed if we have the right stoma appliance. And this is where we need the help of the Ostomy Association and also our friendly neighborhood ostomy nurses. Here we see a parastomal hernia, and oftentimes, if these are uncomfortable for patients, surgery may be needed. These are acute things which I don't want to talk too much about. Sometimes stoma in the acute phase, if it's not properly done, can die, and you get what we call stoma necrosis, gangrene. Sometimes in late stages, they can be due to tension or twisting of the mesentery. Here you see a stoma that's dead. So this is a difficult and dangerous situation. Here we see partial necrosis, and this sort of partial necrosis can actually heal if we leave them alone and we manage them properly. Here we see just an acute stage edema, and this sort of swelling we can apply, as I said, fine salt, fine sugar, and they can subside quite quickly. Here's a stoma fistula in a patient with Crohn's disease. So this sort of problems, you really need consultation with your surgeon or your doctor, and also with the stoma therapist. And the enterostoma therapist is really a great friend, both of the patient, the stoma, as well as the surgeon who has done the job for you. Because in order to have a good functioning stoma where you can actually go back to your original or go back to a life that you want to live, you first of all need good surgery. But you also need good stoma therapists. And good stoma therapists has got good equipment, good appliances, good product. And also good patient education is very important. And I would like to thank the Osteomy Association for having this sort of seminar where patients can be educated and where issues can be brought up and settled. Now, inadequate or improper appliance can be due to two things. The appliance itself is improper, or the placement of the appliance is improper. And if you're exposed to too much skin, obviously, especially in patients with high output stoma, like proximal stoma, like ileostomy or jejunostomy, as compared to a colostomy, the skin becomes very sensitive because the output, which are intestinal juices, digest the skin and cause skin reaction. And often you get this sort of problems. Now, ConvaTec has this moldable stoma appliance, which I would say a little bit about. Rather than cutting, a lot of the stoma appliance, you have to cut a hole. And if you don't cut it, fit snugly, the skin, especially around ileostomy, can be exposed to the stoma effluent and you get a lot of reaction. So with this ConvaTec moldable appliance, you actually basically use your fingers to pull the hole backwards to fit the stoma. And this very soft moldable skin barrier, it just fits to the shape of the stoma. And in fact, on contact with the effluent, it absorbs fluid and it becomes what we call a turtleneck and fits very snugly. So you don't get skin irritation and skin problems. And of course, the ConvaTec also has this convex, wafers, which are able to treat very accurately those patients I talked about earlier, those with retracted stoma, those with flush stoma, those with stoma and skin crease or scars, those who have retraction because of weight loss, weight gain, or those with poor abdominal muscles. And so these are very useful devices which your stoma therapist can advise you to use if you have problems currently. So it's always good to have a consultation with your stoma nurse, and don't try just to try and solve the problems yourself, because they would have much more experience and they would have good knowledge of the wide variety of appliances that can be used in your situation. These are all the various appliances that can be used. We won't talk too much about them at this time. Now, so when we talk about healthy living, I think a lot of people don't understand this, but I want to say that we should eat normally. We should eat properly. And as I said, and I want to emphasize again, we should eat what we like. Okay, barring those things that are sensitive, that gives us problem. All other things we can eat. Right? Eat what we need. Now, a person like Sarah who is training abdominal muscles, you need to eat your protein, because protein is very important for body regeneration, for muscle building. You cannot build muscles by drinking water. You cannot build muscles by eating cellulose, because there's no protein in there. Now, you need energy if you want to run marathons, you want to do exercises, you need to eat your carbs. And that includes, sugar, that includes your rice, your noodles, your bread. Okay, don't avoid those things. We see many patients, especially those who had a stoma because of cancer, and they say, oh, my neighbor, my father, my spouse tells me not to eat anything with sugar. Now, the body needs sugar. If you don't have sugar, your brain will shut down. People faint when they're hypoglycemic because the brain cannot work without sugar. How much we eat depends on what we need. We don't overeat until we become too fat, but we shouldn't undereat until we become malnourished. Now, secondly, besides eating, we should do whatever we want to do with a stoma. You can see in the situation with Sarah, she's doing what she likes. Now, not all of us are keen on exercise or running marathons, but we certainly can go back to what we like to do. Our work, our hobbies, our friends, the people we go out with, and whatever else we have been doing before or we have always liked to do, we can continue doing them. So work, hobby, recreation, social activities, we should continue doing them. And there's no reason why we can't do them. Here we see this person who went on to win the bodybuilding championship, although he's an osteomate. You can see he got the championship trophy here. So really, a stoma is not the end of the world. It really is just an opening to a new world. And we should view it as such. Your surgeon has put a stoma there because he knows with it, you can live a new life. Well, thank you very much for listening. And if you have any questions, I'll be happy to answer them.
Thank you, Prof. Sia, for such an interesting and insightful presentation. Okay, I would like to invite the audience to post your questions to Prof. Sia in the Q&A function. Okay, Prof. Sia, there's a question here. Should all ostomy patients receive blanket referral to see a dietitian post-op?
Well, I think it all depends on what. I don't think a blanket referral is necessary. Certainly, a person with a colostomy, really, there's not much difference in the output between before and or after surgery, because feces are well formed and there isn't really too much of a problem. Now, of course, as I said earlier, if the stoma is small and there's some obstructive symptoms, he will want to decrease foods that give him large, bulky stool, which is basically dietary fiber. But if the patient has had a very proximal stoma, like for example, in the too much of the large intestine or small intestines have been removed, and he has ileostomy, which is quite proximal and output is high, then in consultation with the surgeon, a dietitian's advice may be good. But normally, the surgeon will give him some anti-laxative, which is something for hardening the stool, slowing intestinal transit, and then he just have to avoid taking irritant foods, which basically means things like curry, pepper, chili, which causes intestinal hurry in most patients. So really, a blanket referral would not really, I think, be necessary.
Okay, Prof. Sia, there's another question here. Why I do not feel painful after stomach operation and thereafter?
I'm not sure what this means. You mean after the surgery there's no pain? It means the surgeon is quite good, right?
Yeah,
can you clarify what you mean by? Maybe the Mr. Tia can clarify that question. Now, okay, next one, Dorothy is asking, how do you rectify the problem of insufficient digestive enzyme? Now, it is not so much insufficient digestive enzyme. I think it's sometimes the gut is too short. So if the surgeon has to cut out, let me just explain a little bit. The large intestine, the main function is to absorb fluid. The stomach and the small intestine digest food and absorbs nutrient. So if you have this large intestine taken out, you initially, the stoma initially put out a lot of fluid, but over a period of time, the small intestine can become better at absorbing water. So you shouldn't have too much of a problem. But if a lot of the small intestine has been cut out, so you are left with a shorter gut, then of course, the small intestine may have a hard time trying to absorb all the fluid and all the nutrients that it comes to it every day. In which case you may have a lot of effluent, a lot of discharge, and some of it would be food that would otherwise have been absorbed. So in which case, normally what we do is that we try and slow a gut down by giving you constipating agent so that the fluid becomes more solid and you absorb more. Now, in the very rare cases where the stoma is not able to cope and there's a lot of loss of nutrients, then some patients may need to have additive nutrients through the vein or through some other means.
So, Prof. Sia, maybe I can allow Mr. Tia to explain his question about not feeling pain.
Yes.
Just allow him to talk.
Yes.
Mr. Tia, you can unmute yourself and explain your question, please. Mr. Tia, are you there? Okay, maybe he's not. All right, we move on to the next question, then we'll come back to Mr. Tia.
Okay,
Yes.
there's a question from Jess. Should a person with an ileostomy be careful when taking too much fiber, or should the vegetables be cooked thoroughly?
Yeah. Okay. As I said, I just want to answer this so that you understand. I'm not saying you can't eat any of fiber. What I'm saying is the hole, the opening of the stoma is not like the anus. The anus can stretch, you know, so that if if you remember, sometimes your stool is too big, you can stretch it and then it can come out. Of course, there may be some difficulty, but in the stoma, the size of the stoma is fixed. Now, if you take a lot of vegetables, if the stool becomes too bulky, and this should not happen in a patient with ileostomy, but in a patient with colostomy, it can happen. Then if the stool is too big, it may get blocked. So, so you got to just be careful. Don't overtake the fiber if you have a small stoma. And even patients with ileostomy, if there is a very small ileostomy or there's king or adhesion, sometimes this can cause blockage if you take too much. Now, fiber is not digestible, whether it's cooked, whether it's chopped or minced, or whether it's baked or barbecued, because humans don't have cellulase to digest cellulose. So that's where the problem comes in. Now, the next one, somebody said, okay, Mr. Tia has asked the question again. I do not feel as though I have gone for the operation. You mean that after the operation, you don't feel that anything was done? Perhaps the surgeon has done a laparoscopic surgery, right? So you don't have, the wounds are small. That's why you don't feel any pain. I mean, that's a bonus, right? That's a bonus. Most people don't want to have pain after surgery. If I don't understand you correctly, perhaps you can just type your question out again. Now, anonymous attendee says, someone once told me his output can go as high as 1,400, 1,500 mils. He's so sick of eating loperamide. Yes. Well, it all depends on what the situation is. Eating loperamide is actually very safe. Loperamide is a very safe drug. Now, one of the other things, of course, is eating, as I said, eating fiber. If you take fiber, it bulks the stool. So the fiber may absorb the fluid. But if that doesn't help, then we look, is the high output because he's got a very short intestine? Or is the high output because he's got residual inflammation of the intestines? So this is a question we can only answer in conjunction with his doctor. So if he asks his doctor, what's the cause of high output, they may be able to resolve it. If it's a temporary stoma, they may want to reverse the stoma so that he can have more bowel downstream. Otherwise, if all the bowel has been removed and he's got short stoma, there's no way of doing anything except giving him things that will constipate his bowel a bit.
Prof. Xiao,
yes.
Prof. Xiao, I think further to that particular question, Mandy is asking, for such patient, must we control the intake of amount of water like normal people to prevent loose stool?
Okay. Now, this may be counterintuitive. If you want to drink less water so that there's less output, that's totally wrong. Okay. The reason is when you lose a lot of stoma fluid, the danger is you're going to be dehydrated. Now, when you drink less water, you're going to be even more dehydrated. So you really have to catch up. If there's a lot of output, you have to drink more water. But it's not just water you need to drink. You need to drink, in fact, Sarah did mention this, isotonic fluid is the best. Now, if you drink just plain water, this plain water is going to actually draw out more electrolytes. So you may find that your output may be even more, So you want to drink some isotonic fluid so that you don't lose salt and you don't lose water as much, and you can replenish your fluid. Okay, so never stop drinking because you think that you're going to have more coming out. You have to replenish the water that's lost. This is called a balance chart, right? Input and output must be equal, or otherwise you'll be dehydrated.
So Lynn has just typed in saying that oral rehydration salts will be good, balanced with free fluid and salt water.
Yes. It's not just salt water. In patients with ileostomy, they lose a lot of potassium also. Now, I know many of our patients here may be diabetic as well, and if they're taking insulin, their potassium is going to be low. If they have stomas, a lot of the stoma patients have low potassium. So this is where, you know, things like fruit juices are very important also to replenish potassium as well as sodium salt. So don't just think that, you know, you just need sodium, you know, or just water. There are a lot of other electrolytes that are very important for body function, heart function, muscle function.
Okay, Prof, there's a question from Mr. Fu. Why is my stoma expand after cooling down from exercise?
You probably have a little bit of stoma prolapse. If you exercise, there's increased intra-abdominal pressure. So if you are, for example, like doing sit-ups and doing other squats or running, there's a contraction of your abdominal muscles. Your intra-abdominal pressure increases, so your stoma prolapses a little bit. That's why you see that it's big. Now, if you just rest for a while, your stoma should become a bit smaller. If your stoma prolapse is very big, of course, you got to be aware and you know, don't let it come out too big and let it be obstructed. Then you get edematous and you might get a problem.
Yeah, and there's a question in the chat. I'm on 2 bags. It is about 8 months since my last surgery, which is my 3rd surgery. At least once a week, I have sudden abdominal cramps. Is this expected? And painful cramps which last for 3 to 5 minutes.
2 bags, meaning intestinal bags or 1 urine bag. It doesn't really matter. I just want to clarify that. But a lot of times intestinal cramps due to 2 things. Okay. If your bag is still working, fluid is still coming out, it's not obstructed. But if suddenly there's no gas, there's no fluid, or there's no feces, then it may be obstructed. If it's obstructed, obviously you're going to have severe cramps. Now, if you had 3 surgeries, then there's going to be some adhesions inside. Adhesions meaning some loops of bowel may be stuck to some other loops of bowel. Now, this is sort of situation where I always tell my patients, try to avoid fiber as much as possible, because the clumps of fiber may be stuck at those points where there's adhesions. And then you have cramps and you have this, you know, it comes and goes because the bit of fiber is stuck at the point of narrowing and your intestine is contracting to try and push this through. And when it cannot go through, you get more and more painful. But once it goes through, then of course the pain eases. So try to avoid fiber if that's the case. Otherwise, if there's abdominal cramp, and it's sometimes also due to gas. Now, gas is something else that we have to understand. Also, unfortunately, due to fiber, because if we cannot digest fiber, fiber goes in the gut, it ferments. Those of you who have pets like dogs and cats, you know this. My dog and my cat, they eat meat, they never have gas. In fact, they never fart. But you look at animals that eat grass like sheep, goats, horses, camels, you know, the tummy is bloated, they are farting all the time. So cramps can be caused by gas. Now, of course, the third reason, if you have some underlying diseases there like inflammatory bowel disease, you may have cramps from those other reasons. So there are other reasons for cramps. So it's best to actually speak to your doctor and find out what the reason is for those. But those are the common things that I see.
Okay, there's a question from Patrick here. Patrick mentioned that would soluble fiber food be better compared to high fiber?
No, soluble fiber and insoluble fiber are just names for fiber. They are still indigestible. So really, they are just sort of confusing the issue. The issue is soluble fiber tends to ferment with gut bacteria. Insoluble fiber just gives you bulk. So both of them may result in different problems that you see. So the thing is, as I said, if you like to eat fiber and veggie and fruits, go ahead, but don't overdo it. If you find that after eating you get cramps, after eating you get a lot of pain or a lot of gas. But if you have no problems, and do what you like. Okay. The thing always is, you know, very important in whether you exercise or whether you you don't exercise, or whether you eat this or eat that. The problem is, the main thing is do what you like to do. Okay, but if what you like to do gives you problem, don't do it.
Okay, there's a question from Clee. Is it okay to take black coffee?
Well, I don't take black coffee because I hate it. I like to have my coffee sweet and white. But if you like black coffee, there's no reason why you can't take it, right?
Okay, there's an anonymous attendee here. He mentioned originally my doctor said the temporary colostomy can be reversed. However, at 3 months check, the doctor said that the opening is a little narrow to do the reversal surgery. After they do the liquid and scope test, okay, and there could be risks of blockage if the colon is reattached and could warrant a major op to remove the blockage. Okay, is there no chance for reversal surgery? My dad is already coming to 6 months on stoma.
Sorry, let me just read that again slowly. Now, I think what he's saying is not that the colostomy opening is small. He probably had a stoma to protect a anastomosis of the colon to the anus, and that anastomosis is narrowed, and therefore he feels that if you close a stoma, that stoma closure may burst because the opening is too small. No, there are ways to do it. If the anastomosis of the colon to the anus or the rectum is narrowed, that can be dilated or that can be made bigger. Now, once you dilate it, then there's no obstruction. Then you can close the stoma once that obstruction is dealt with. Of course, if you close your stoma when there's obstruction, you're asking for trouble, right? Because you are closing the stoma and there's not going to be the ability to defecate. So you have to see your surgeon and ask him, can the opening be dilated or made bigger?
Okay, Prof, we have time for just one last question. Okay, Jess is asking, I have a loop ileostomy on my right, but I have been getting pain on the left side. Intestinal pain on the left side. I also need to pass mucus quite often. I cannot push out the mucus without the help of suppositories. Okay,
does it mean that Jess, does it mean that you have you're passing mucus through the anus? Now, if you have an ileostomy and there's your rectum or your anus and removed, and your mucus is coming out from an ileostomy, left-sided pain could be just due to gut of the intestine proximal to the stoma is lying on the left, on the right side or the left side. So it doesn't really mean anything. But if ileostomy is there and you have your colon intact, you definitely will be passing out some mucus because the colon is left behind, does not have feces going through, but is still going to produce mucus. So it all depends on what situation you have, and I'm not able to really understand or give you some understanding of situation because I don't have your full medical history here. Yeah, you see your colon is intact and it's coming through the anus, so it just means that either there is some underlying disease process still, or in fact, all colons, if they are not functioning with feces going through, they'll have something we call diversion colitis, inflammation due to no feces. Because feces, you may be surprised to know, is actually for the colon mucosa or the colon cells. So if you don't have feces, the colon will be suffering in some ways, missing their familiar friend, and they will produce a lot of mucus.
Okay, all right. So I think Lee was actually explaining further with regards to his earlier question.
Yeah. Okay. So he had a leak, and because of the leak, the joint is very tight. Now, it all depends on the surgeon and depends on the surgeon's capability and also on how tight it is. Some of this tightness can actually be repaired. Some of them cannot be repaired. So you should have a talk with the surgeon to see. Thank you very much.
Okay, thank you. Thank you, Prof. Xiao. Okay, next I would like to actually invite Jurina Key, the Assistant Marketing Manager for ConvaTec, to share on the new Me Plus program. Jurina, please. Jurina, you're on mute.
You're able to see the slides?
Yes.
Yes.
Just run through the slideshow. Right. A very good afternoon to all. As introduced by Audrey, I'm Jurina Key from ConvaTec Marketing. I hope you have enjoyed the session as much as I do. Special thanks to both Ms. Sarah and Prof. Sel, who have respectively shared a very inspiring story with us and also insightful teaching on stoma complications and healthy living with a stoma. Well, getting used to living with an ostomy takes time, and sometimes it's hard to know where to start. Here, I'm going to share a very unique program, Me Plus, which ConvaTec is launching in Singapore very soon, especially for our ostomates. This program has benefited many ostomates in the launch countries. Me Plus is basically a free support network designed especially for ostomates. We are here to provide you the services and care, insights, and products you need throughout your entire ostomy journey. Right, let me walk you through the Me Plus program highlights. At Me Plus, we are really committed to helping ostomates live with an ostomy in a way that works best for them. It is why we do what we do. Our program, which focuses on the 5 main pillars, includes the recovery that Sarah has shared a lot, the care, the support, answers, and the community, which all aims to provide ostomates with a holistic and dedicated support, inspirations, insights, and ideas you need to live the life you want to live. Right, let me start with Me Plus recovery first. We understand that too many people are worried about harming themselves by doing physical activity, when in fact, there are so many benefits to being active. We can hear from Sarah how her active life has let her live the life as normal. And Me Plus recovery is basically a holistic, patient-centered recovery and movement program for anyone who has a stoma. And it's also a training course for stoma care nurses, which is accredited in some of the markets here. It is a progressive 3-phase series focusing on the gentle core exercises to help rehabilitate the abdominal muscles so you can get back to living the life you want. Importantly, right, Me Plus provide information on lifting, moving around safely, strengthening the pelvic floor. It's actually a 3-phase core and abdominal series and more. Right. Moving on to Me Plus Care. It's actually so much more than just a package of ostomy products and accessories. With Me Plus Care, members actually get the tools, resources, and the product supports they need to help manage their stoma without it changing the life they want to live. Most of all, it gives you direct access to our compassionate, highly trained specialists. When you have questions or need advice, when you get the right support, I'm sure you will feel stronger, confident, and ready for what is ahead of you. Well, we all know that you will have questions as you navigate the ostomy journey. Our expert team of nurses and customer and product specialists will make sure that you are on the right product. They will make sure that they are caring for your stoma correctly. And we can actually send you free samples to trial upon your request. And when it comes to like clinical issues with your stoma, we can actually put you through in direct contact with our compassionate nurses to listen and answer to your questions as you adjust to living with an ostomy. They can actually teach you on how you can care for the skin around your stoma and change your pouch, plus help you cope with like some tricky lifestyle issues and anything that may come your way during the whole entire journey. Okay, like I mentioned earlier, it's only natural that you have questions as you begin life with an ostomy. So in fact, we have curated a platform of honest, insightful tools that are constantly being updated, which we call Me Plus Answers. It is designed to give you the current, updated education, information, and advice that you need to gain that confidence and get comfortable with your ostomy, all in one convenient place whenever you need it. In the Me Plus Answer resource, we cover topics like caring for your stomas, easy to understand information that shows you how you clean your stomas and properly care for the skin around it, pouch application guides with step-by-step instructions, completes with pictures and videos to teach you how to put on and change your pouches. And we also cover things like diet and nutrition, tips on which foods and drinks to avoid, which to enjoy, because living with an ostomy doesn't have to stand in the way of savoring every meal. Like what Prof has said, eat what you like, eat what you need. Life and style, we also have answers about like physical activities, travelings and tips. At the end of the day, because your care should fit the way you want to live and not the other way around. Okay, I think sometimes the best advice comes from someone who has already been where we are now. In Me Plus community, it actually connects the ostomates with people who have been right where you are now. And Me Plus community actually highlights the stories of people living with ostomy, doing the things they love. And we strongly believe that living with an ostomy should be fulfilling and still complete in their life. Most importantly, here, I want to emphasize that you are not alone. With Me Plus, we completely surround you with all the support, the inspirations, the insights and ideas that you actually need to live an ostomy in your own way, in your very, very own way. It's more than just like great products that ConvaTec are offering now. It brings you the tools and advice to help you make life with an ostomy completely your own. Okay, as a first step to becoming a Me Plus members, I would actually encourage you to join us as a ConvaTec member if you have yet to be one. Allow me to just briefly run through with you the benefits as a member. To begin with, we will be setting up the Me Plus Ostomy online support and resources very soon. As a new member, you will have 2 times home visit post your operation by appointment with our appointed specialist nurse clinician. And there will be access to 1 complimentary stoma assessment service at our ConvaCare clinics by appointment, and this is good for 12 months from the date of enrollment. On your birthday month, we would like to present to you a 20% purchase discount. And all this purchase, right, the points will be awarded for all the purchase which you can accumulate for a product redemption at a later stage. We have our very friendly customer service that can actually service you and share with you upon the application completion. Of course, for every enrollment, we also like to award you with a 50% bonus point to help with your product redemption. There's also a delivery service to your house doorsteps for products order of minimum of $100. And as we constantly innovate on new products to help ostomates in new products previews and sampling programs, you will be the first that we want to reach out to let you experience the new creative and helpful products for your daily use. And last but not least, we would definitely love to invite you to exclusive events like the webinars that we are currently having now. Okay, if I were to just move on a little bit to touch on our clinic, let me share that actually ConvaCare Clinic was established since 2009 in Latin America. We are actually an international clinic group with specialized in wound and stoma management. This first Asia Pacific clinic, which opened in Singapore in April 2021, which is just like last month, we actually have a team of clinical experts and support staff dedicated for the evaluation and treatment for our patients using a holistic approach. And of course, there's a standard treatment protocol that we adhere to that we believe can give the best outcome for our patients. As you can see here, the comprehensive stoma cares can include like your stoma site assessment, your stoma dressing and applications, the change of stoma and appliances, and of course, along the way, we will also have stoma teaching and counseling service available for you. ConvaCare Clinics provides both the in-clinic service where you can visit us at the Novena Medical Center, or you can also call for a home service. So contact the clinic staff at the number that are shown here and let us help you get back to living life to the fullest. And finally, I would like to encourage every one of you to join us as a Me Plus member. You can easily sign up with us by contacting us at this main line 6245-9838, or via our mobile line at 91251523. Alternatively, you can also email to us at enquiriessg@singapore.com. So with here, I end my sharing on Me Plus support program, which is a program that I'm excited to launch in Singapore in the months to come. Yeah, thank you so much.
Okay, thank you, Jurina. Next, I'd like to invite the audience to post your questions in the Q&A box. Okay, so far there's no question. Okay, in the chat box, okay, there's a question from Shantanu. Okay, Shantanu mentioned that last couple of months back, I was told ConvaTec Singapore was revamping their support system in Singapore. If I share the part numbers, can you help me with regular supplies? My requirements are fixed over a month. Oh yes, Shantanu, we can actually definitely help you on this issue. You can call us perhaps on Monday. We can help you with your orders. Are there any questions for Jurina? Okay, Jess has a question here. When will the Me Plus be launched?
The resource, the online resource, we are targeting to have it available on the website by August. And definitely, we will actually send a notification to you nearer to the launch date.
So the resources will be available from August onwards. But for now, the membership has already been started. Yes. Right?
There's no membership fee. It's actually free for all.
The current ConvaTec members will be actually automatically be included in the Me Plus program. Yes. I think for those members who are wondering, yes, you'll be automatically be included in the Me Plus program. Okay, there's a question here, how to sign up for Me Plus for stoma nurses? Okay, Jurina, you want to answer this? Or I'll take it from here?
Yeah, you can actually take it from there for the nurses.
Okay, for the nurses, if let's say you want to access the information and the information as what Jurina has shared, okay, the website will be available from August onwards. So there is no requirement for you to register as a Me Plus member. So Me Plus member is basically for ostomates, in fact. Okay, Jess mentioned I am a member. Okay, good, Jess. And then Maverick is asking, could copy and paste the Me Plus sign up links? Okay, Maverick, just wondering whether are you currently a ConvaTec member? If you are, we will just automatically include you in the Me Plus program. You'll be automatically be a Me Plus member already, in fact. Okay, Mr. Fu is asking, is 20% discount above on the birthday month? Yes. So throughout your birthday month, you'll be entitled to 20% discount. Okay, regardless of how many times of purchase within the same month. Okay, Maverick mentioned that he's a ConvaTec member now. Okay, Ken. So definitely you'll be included as a Me Plus program member moving forward. Okay, I think we have come to an end of the webinar. Okay, I would like to invite Mr. Eliel to give the closing speech. Eliel, please.
Thank you, Audrey. First of all, I want to thank our two very distinguished presenters for their generous and valuable sharing. I would also like to thank ConvaTec and their team for putting together this webinar. Right, but most of all, I want to thank all of you for making time to join us this afternoon. We really hope that you have found today's session useful and encourage you to get in touch with the teams from ConvaTec and OAS if you wish to find out more. And we'll also be posting a recording of this webinar on our OAS website in a few days' time. So if you or your friends have missed part or the whole of this webinar, you can go and log into the website and view the webinar from there. The address is www.oas.org.sg, right? And just a gentle reminder to all the nurses who attended, you will receive a follow-up email after today. Please fill in your particulars and submit it to us to claim your CPE points. And lastly, in order for us to bring you more and better webinars, please fill up the feedback forms that you will be directed to at the end of the webinar and tell us how we can improve. And if there's one takeaway that we would like everyone to have after today's webinar is you are not alone. There's lots of help out there. Please reach out to us at OAS or at ConvaTec if you face any problems. And like what Prof. Xiao had said, sometimes when there's an issue, you need to have the doctors check it or go and approach your friendly neighborhood stoma nurse. Right? With that, thank you. Have a wonderful weekend. Stay safe and keep well. Bye, everyone.
Thank you for participation. Thank you, everybody. Take care.